20 years ago, when I moved back to Australia, I was unsure if I was making the right decision. I was keen to go home, but I also knew that I would be subject to certain restrictions, being a foreign graduate. For example, working in an area of need for 10 years. Nonetheless, I returned home. And over the following years, I observed that some foreign doctors seemed to have more challenges than others by no fault of their own. I witnessed various inequities, from unfair roster allocations to blatant racism. So I decided to do a PhD looking further, and these are the results of my scoping study, which I did as part of my research. It's been published in BMJ Open just recently, and you can access the full article if you wish. I undertook it with my supervisors, Professor Kitchu Nair and Dr. Christy Fakes at the University of Newcastle. So for the purposes of the study, I use the term IMG, which means International Medical Graduates. So this is a doctor who has obtained their medical qualification outside the country that they're working in. So I am IMG, and many in this room will also be IMG. Although there's a decent body of work out there looking at IMG challenges, most of them focus on exams, licensing, training, and acculturation. But if we look closer, there's often a little cloud of discrimination which accompanies these. So the research question was, what common experiences of inequitable treatment have been directly reported by IMGs in the literature? And we defined inequitable treatment as discrimination, bias, or prejudice. And to be eligible for the scoping review, these had to be directly reported by IMGs, either by interview or survey. And excluded, I should mention, were other scoping reviews, systematic reviews, letters, editorials, and so forth. That was really primarily to avoid duplication. So this is a prism flow diagram of our scoping review. We searched Medline's, PsycInfo, and Scopus in addition to the grey literature, and identified 962 publications. And then following the removal of duplicates and exclusions, we resulted with 33 that went through for analysis. These represent 31 studies. So the vast majority were interviews, came from interviews, and there were a handful of surveys, a handful of mixed studies, and almost half of them originated from the USA and Australia. There were a few from the UK, a few from Canada, a couple from Germany, and one each from Finland, South Africa, Austria, Ireland, and Saudi Arabia. We identified 6 common themes of perceived inequitable treatment. By far and away, the most common was inadequate professional recognition, followed by lack of choice and opportunity. Almost half of the publications mentioned marginalisation, about a third verbal insults, third favouring local graduates, and 3 of the studies reported harsher punitive sanctions. So looking closer at these in a bit more detail, inadequate professional recognition occurred at both an interpersonal and institutional level. IMGs reported that their skills and experience were under-recognised. There was also this perception that their IMG qualification was inferior. And this was not just from institutions, but also colleagues and peers. There was a need, or IMGs reported a need to work double as hard when competing against local graduates for career promotions and awards. IMGs also reported limited freedom and control over their future. They reported that institutions imposed restrictions on their location and specialty, which resulted in clustering of IMGs in certain jobs. And they also reported restrictions to training and study opportunities. So marginalisation is subtle interpersonal exclusions or isolations, and these occurred, this happened with staff, so usually medical colleagues and also nursing colleagues. Examples included slighting attitudes, hostility, othering, stigma, and stereotypes. So culturally inappropriate derogatory remarks were less common, but they occurred with patients and staff. And in this next category, IMGs reported that local graduates were routinely preferred and appointed for positions, sometimes even when the IMGs had superior experience. Also noted was a differential preference for IMG groups who had come from European countries or those from Commonwealth countries, and they were seen to have preferential selection over other IMGs. And finally, harsher punitive sanctions were experienced or anticipated by IMGs in relation to complaints and investigations and repercussions for speaking out. So over half of the papers that identified some sort of effect on well-being in relation to the inequitable treatment. And here are some of the words that IMGs used in their surveys or interviews and how they felt. So we also identified that most studies had proposed solutions or reported some proposed solutions for inequitable treatment in their discussion, and we categorised these into 4. And here's a couple of examples of these. So mentoring and networking was a very popular suggestion. Registration, training, exam support and services directly for IMGs to support them. Structural change was a big one, in particular recognising prior experience. And of course, workplace harmony. So what does it matter? Why is it important? So there is growing evidence that racial discrimination is a determinant of health, negatively impacting on not only mental health, like stress, anxiety and depression, but also physical health outcomes such as heart disease, obesity and hypertension. Unsurprisingly, subtle racial microaggressions at work also contribute to poor job satisfaction and workforce retention rates. And this UK study reported that systemic disadvantages in race, ethnicity or IMG status can influence career outcomes also. So the next part of my research is to do a nationwide survey in Australia and do some interviews as well, looking at experiences of discrimination, impacts of wellbeing, mental health and career trajectory, and acceptability of proposed solutions. And so I'm hoping that my findings at the very least will spark some interest in this topic and discussion, and with any luck, action, some change for a more equitable society. And these are my very naughty children.